Knock, knock, knock. Hand hygiene. Hi, my name is Mallory. I am a student nurse and I'm going to be doing your 10-minute assessment. Do you mind giving me your name and date of birth?
Angel Collier, 12/30/72.
Good. Do you have any allergies?
Mm-mm.
Okay, I don't see any trip hazards, so we're in a safe environment. So before we get started, can you tell me your who you are, where you're at, and today's date?
Angel Collier at my house, and it's October 6th.
Okay, are you experiencing any anxiety or restlessness?
Mm-hmm.
Okay, so your face, it looks symmetrical. Can you smile for me? Good. Your smile is symmetrical, so now I'm going to look at your pupils. Your pupils are equal, round. They're reactive to light, and they accommodate. So can you look at the pin in the wall? Okay, good. Now I'm going to measure them. They're at 5 millimeters. Okay, so for your vision, can you read the sign behind you?
Our nest.
Okay, no blurriness or anything. Okay, so for speech, you're speaking clearly and at an adequate volume, so that's good. Hearing, I'm going to say a 2-syllable word behind you. You're going to cover one ear and repeat the word back to me. Basketball.
Basketball.
Okay.
Baseball.
Good. Okay, so previously we took your vital signs. So I'm going to read those off to you. Your blood pressure is 126/84, respiratory rate 16, heart rate is 77, temperature 97.9, and pain you stated was 0. Okay, so we're going to move on to your respiratory and cardiovascular assessment. So your breath sounds, they have been looking eupenic, so not labored, they're even, and you have symmetrical chest rise. Okay, I don't see any tubes or drains, so you're not on supplemental oxygen. I don't see any suctioning. Okay, so now I'm going to listen to your breath sounds. If you don't mind taking a few deep breaths in and out for me. Good. Good, I'm going to come over here to your side. Good. Good, 6 more on your back. Good. 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 So those all sounded really good. They were clear with no wheezing or stridor. So now I'm going to listen to your heart. I have five landmarks, so 5 things I have to listen to. Okay, so I'm going to listen to your aortic, which is the second clavicular line on the right side. Okay. S1 and S2 at a regular rhythm. So now your pulmonic, so second intercostal space on your left side. S1 and S2 and at a regular rhythm. Okay, now your fourth clavicular intercostal space on the left side, and that is your tricuspid. Okay, fifth intercostal space, your left side, that is your mitral. So now for your apical pulse, I'm going to come under your shirt. Okay, S1 and S2 are noted at a regular rhythm. So now I'm going to feel your peripheral pulses. So I'm going to do your carotid first. Okay, that's +2 and regular, +2 and regular. Now I'm going to do your arm, +2 and regular, +2 and regular. Now your radial on your wrist, +2 and regular, +2 and regular. If you don't mind laying back for me, I'm going to do your femoral, +2 and regular, +2 and regular. Okay, you can sit up and scoot off the bed a little bit. Your popliteal, +2 and regular. Other one, +2 and regular. Now your posterior tibial, which is on your ankle, +2 and regular. Okay. +2 and regular. Your dorsalis pedis, +2 and regular, +2 and regular. Okay, now I'm going to check your capillary refill. So brisk, less than 3 seconds, brisk, less than 3 seconds, brisk, less than 3 seconds, brisk, less than 3 seconds. Okay, so now I'm going to do your skin assessment. So I don't see any tubes or drains, so no feeding tubes. So I'm assuming that you take all your food and drink by mouth. Okay, your skin, it looks intact, pink, upper and lower extremities. It's warm, okay, and it's dry. Now I'm going to check your skin turgor. Okay, so you're well hydrated because it was elastic. And I'm going to look for edema. Okay, no edema on upper extremities and no edema on lower extremities. I'm going to look at your pressure points. So your occiput, there is no redness or skin breakdown. Your scapulae, no redness or skin breakdown. Your elbows, no redness or skin breakdown. Your gluteal, no redness or skin breakdown. And your heels, no redness or skin breakdown. Okay, so I'm going to ask you a few questions. How would you say your appetite is?
Good.
Okay, you eat regularly when you're hungry. Perfect. When's the last time you voided?
About 30 minutes ago.
Is that normal? The last time you had a bowel movement?
This morning.
Is that normal? Okay, you haven't had any nausea or vomiting. Perfect. No vomit. Good. Okay, you can go ahead and lay back. And I'm going to feel your stomach. Okay, it is flat and non-distended. I do not see any incisions. Okay, so now I'm going to listen to your stomach noises. Okay, so those were normal, active, in all quadrants. Now I'm going to feel for tenderness, firmness. Okay, you can go ahead and sit up. So now I'm going to assess your mobility and your strength. Can you squeeze my hands for me? Okay, can you pull me towards you? Good. Can you push me away? Good. Can you pull your legs towards the bed? Good. Those were all nice and strong. Okay, can you go ahead and stand up for me? Okay, your arms and legs are symmetrical. Can you take a few steps? Good. Your gait is steady and balanced. You can have a seat. Do you mind tilting your head side to side, raising your arms? Okay, so you have full range of motion of your neck and upper extremities. I assessed your lower extremities when you walked and you had full range of motion. I do not see any therapies such as restraints, ice or heat, and no family or friends present. And now I'm going to do hand hygiene and leave.